Professionalism, liability, and pitfalls. So these are just some questions I want you to keep in mind as we move through this lecture. How do you conduct yourself as a professional? What kinds of things do you think fall under quote-unquote professionalism? As a medical scribe, you're charting a legal document when you interact with the patient's AHR. How liable are you if something goes wrong? What are some of the pitfalls to watch out for when you're a medical scribe or any member of the professional team? So some things that we think about when we're talking about professionalism or being professional in a work environment are questions like, how are you supposed to dress? What are the grooming standards? And there are some that are pretty specific to a clinical environment. As a scribe, how should you interact with other members of the medical team? How should you interact with patients? Of course, this isn't all-encompassing of professionalism, but this is some of the main points that we want to focus on. Let's first discuss what to wear. So, of course, each workplace will have its own defined dress code. Sometimes this will be across the board for all positions. Sometimes this will be position specific, depending on what your job is. But some of the options. So you may be required to wear a professional polo of your own or of the institution with professional pants. Some workplaces will ask you to wear scrubs. In any and all cases, no matter what you're wearing, you should keep your work badge stating your name and job title in plain sight. This is to help decrease confusion of other staff as to what your role is. This has helped decrease confusion of patients as what your role is. And in every clinical area, you should wear closed-toed shoes. Some places will require a certain color. Some places will specifically ban, certain kinds of shoes like Crocs. But in general, closed-toed shoes are going to be pretty standard as a requirement across the board. Some common grooming standards for the medical environment specifically. So generally we'll say no strong perfumes or hair products with strong odors. Sometimes this can trigger people's asthma. It can make people nauseous. No excessively long and or fake nails. So each facility will have a slightly different policy, but the nails pictured in the photo in the center here, you can see like a person wouldn't necessarily be able to put on your standard medical gloves and interact with a patient. It can become very unsanitary. Overall hygiene should be excellent. People should be bathed, should wear deodorant, etc. There are generally a couple other grooming standards when it comes to hair color, like I said, with nails, and then tattoos. Some institutions will allow, only one visible tattoo as long as it's not offensive. Some institutions will allow you to have visible tattoos over your whole arm, etc. I will say that most institutions are moving more towards they're catching up with the times, is what I want to say. We're having more and more young to middle-aged professionals that have tattoos. They're qualified, they're educated, and so they're having to open up that standard a little bit. Myself, for example, I've clinical doctorate. I work as a nurse practitioner. I have a half sleeve and sometimes a visible chest tattoo. All non-offensive. I can say that I've never lost a job because of it, but it's important just to keep in mind what the standards are for your institution. Now let's talk a little bit about being professional in the workplace and in your social life, more specifically your social media life. Obviously, social media is something that is extremely prevalent right now, so it's definitely something we want to discuss. So in general, you should be punctual, so you should be on time, should be reliable. If you're on the schedule, you say you're going to work, you need to be there. It not only affects you, your institution, but the person coming off shift as well. If you're late, if you don't show up. Flexibility is always a good quality to have in healthcare. We've seen over the past years now that we have to remain flexible in order to make care work for patients. So it might not be, um, the status quo, and we just need to be able to change as the needs change. In your interactions with physicians, nurses, and other staff, be polite and respectful. I think this goes without saying, but I think sometimes we need to be reminded that we should always be polite and respectful, regardless of whether somebody is acting that way towards us. However, in most cases, if you are polite and respectful to people, they will be polite and respectful to you. Your interaction with patients or patients' family members should be very limited. Again, this is based on your exact job description. If you're somebody that is cross-trained and your job description is specific to that, where you are allowed to do MA duties, you're allowed to do CNA duties, this will obviously change. If you are not, if you're in a strictly clerical position, it is reasonable to say hello, introduce yourself, tell them what you're going to be doing, ask them if it's okay if we mute the TV, etc. For social media, so a good rule of thumb is do not post pictures or stories related to your job. Additionally, make sure your social media does not contain anything that might be considered out of line with the mission and values of your organization. So we all have our personal lives, we all have our social lives, we all have our own opinions. That is all well and good. It's within your right, I guess, to post whatever you want on Facebook, Instagram, TikTok. However, if you're affiliated with an institution directly and they feel that what you're doing or saying does not line up with their values and their mission, most places you probably will have to sign a social media policy. So you'll be in violation of that policy, and they reserve the right to terminate employment. You can copy and paste the link or control click the link to see some examples of unprofessional behavior in the workplace. Now let's talk a little bit about liability. So we're all adults, we're all responsible for our own behavior. So you have to be sure to work within the confines of your scope and your job description and just to behave professionally. Ultimately, when it comes to the final submission of the documentation of the patient's chart, that is on the physician, on the provider. Obviously, your job as a medical scribe is to document everything accurately to the best of your ability, and that's going to help you retain that job so that the physician doesn't feel that every single time you're working with them, they have to go back and read through the whole note. You'll develop a rapport, you'll learn each other, and eventually they'll, learn what little things they need to tweak and then submit the note. So in the next few slides, we'll talk about some common pitfalls to include confidentiality pitfalls, professional pitfalls, and social pitfalls. Some confidentiality pitfalls. So a lot of these will be a review from the previous lecture. So first, while it can be tempting to discuss cases or patients with family or friends, it's safer to avoid it. You have to kind of think about what might happen. So you might just unwittingly give out information that is identifying. For example, most likely your family and friends already know what facility you work at. So if you're talking about the girl who got shot that went to your hospital, they could probably just do a quick news search of the last 48 hours and find out what hospital that person was brought to, and it'll probably give a full name. HIPAA violation. So it's best to just not discuss with family and friends, just in case you're giving out information that might alert them or give them clues as to which patients you're discussing. You should not take or post pictures from work. So what might happen? Why shouldn't you? Because you might not know that there's a chart open behind you. There's a computer open behind you. There's patients walking in the background. Of course, sometimes facilities will choose to post to social media, but those are managed by a specific person who's looking for those kinds of things. If you have a photo that you wish to post that is job specific, job related, it's best to go through whoever is managing the social media account to make sure, hey, is this okay to post? Do I have permission to post this? Do I have sign off to post this, etc. And only speak about a patient with personnel directly involved in their care. For obvious reasons, this is how we maintain confidentiality. I shouldn't be discussing Miss C in room 203 with the cleaning person or the facilities person or the dietary person, unless they're asking me as a nurse or a doctor what their diet order is. That's not to be discussed with people outside of their care. And what do you think is the best way to refer to them to maintain their privacy? So first of all, the best way to maintain their privacy altogether is to go to a place where discussions can take place with not a lot of people around. You don't want other uninvolved staff. You don't want family members, friends walking around the nurse's station. And then also you, instead of saying, oh, Fred Johnson, room 208, you can say Mr. J, patient 208, etc. You can make it as non-specific as possible, especially if there are other people around you. And this YouTube link will just take you to a video of some of those common HIPAA pitfalls, those common confidentiality pitfalls. Now let's talk about professional pitfalls. Scenario. So in this case, let's pretend that you are a strictly clerical medical scribe. You see a patient walking down the emergency department hallway and they make eye contact and ask you for help to the bathroom. What do? This is tough. You know, our inclination usually, especially if you're working in the medical field, is to help people. However, if you're strictly clerical, and if you're assisting this patient and they fall, this is a huge liability. So the correct thing to do would be to ask them to wait a moment, go get staff that is, you know, marked off, signed off to touch patients, a CNA, a nurse, etc., and ask them to help the person to the bathroom. This will also help avoid the person using the restroom if we actually need a sample from them, if you get clinical personnel. Obviously, if you're not strictly clerical, then this would be within your scope in your job description, but if you're strictly clerical, it is not. Documentation errors occur when you miss information or you enter it into the wrong patient's chart and record. If this happens, what should you do? So this is a real pain, and I say this from experience. I have charted entire assessments on very critically ill patients, so it took a while, and then I look at the name of the patient and I've charted on the incorrect patient. So how we can prevent this is by doing things like the pre-patient checklist, by double checking when you open the patient chart, and then if this happens, what should you do? You should, as quickly as possible, remove all that data from the wrong patient chart and re-input it into the new patient chart. This is time-consuming, but imperative that the information you're inputting on the wrong patient doesn't get misconstrued as their correct data, because medical decisions might be made on it. And it's imperative that you get that correct information into the correct patient chart, so for the same reason that clinical decisions can be made. Your shift is at an end, but you have not completed all of your patient documentation in its entirety. What do? So the correct answer here is you finish your charts. You should not leave open charts when you leave for the day. This can get kind of tricky if you're somebody that's constantly in overtime. Your superiors might be putting pressure on you to make sure that you're getting done quicker. You still want to be accurate. So you need to take a step back and figure out how you can become more efficient throughout the allotted time of your shift, so that you're not constantly there for an hour, 2 hours after shift finishing up documentation. Social pitfalls. So has anyone ever worked in a drama-free or drama-filled workplace? Tell us about it. Obviously, this was meant for a class discussion, but think about it. Have you ever worked somewhere where it's completely drama-free or just filled with drama? A lot of drama does surround workplace friendships, relationships. When we're talking about relationships, they are best avoided in the workplace, but if you do plan to engage in a workplace relationship, it is prudent to seek the counsel of the Human Resources Department and what could go wrong. So let's think about this. If, for example, if a manager is dating an associate and then they break up, 6 months down the line, and that manager starts showing favor to other associates over their ex, this is a problem. However, it's going to be harder for the associate to have recourse if there wasn't a documented relationship before that. While a manager should never show preference for any associate over another, this negative treatment is happening, it's seemingly as a direct offshoot of the end of the relationship. If there was a pre-recorded relationship with HR, it would be easier for this associate to correct this behavior. And then how do you think social media could affect your job? So we've seen it, right? We've seen people post, sure, their own opinions, but sometimes very racist, sexist, classist things on social media platforms, very quickly be called out about it, and then lose their job. So you have to be mindful of the caricature of yourself you're building on social media. And does this person, do these attributes align with the organization which employs you? And just another YouTube link here for you guys to check out. If you have any questions, comments, or concerns, please feel free to let me know.